Oops, moving my whole desk.
It's recording now.
Great. Welcome everyone to Student Mental Health and Drug Use, How to Approach the Situation webinar presented by NeuroSight and the Students for Safer Drug Policy. I'll just, my name is Paul North. We'll do our introductions in a second, but I'll just take you through the agenda of today's webinar. So first up, just do some brief introductions from us, and then Arda is going to chat about the current situation based on the survey that we've done. We'll then move on to looking at how to design tools and interventions that are relevant to the needs and worries of the student population. Again, that'll be Arda at 7. Then we'll pass over to Larry, who's going to talk about what do students think of support availability at the university and how to engage students through the Students for Safer Drug Policy. We'll then take questions, and then we'll close at 7:30. People aren't used to Zoom webinars by now, where have you been? But if the bottom of the screen is a Q&A button, so feel free to press that and ask any questions as we're going along. If the panelists can answer the question at the time and it fits in, then they will. If they don't have a chance while they're doing the presentation, we'll take the questions at the end. But do feel free to just make comments and questions as we go along. Also feel free to just share comments in the chat. If you ask a Q&A, obviously just come straight to us as a panelist, isn't it shared? So sometimes it's worth putting something in the chat so you can see what other people think. So let's just do we'll come back to talking a little bit more about NeuroSight at the end, but we're essentially a harm reduction consultancy that works with quite a wide range of organisations, from universities to private organisations, doing contracts at the moment with a law firm, educating their HR staff. And we basically do research, education and policy, but we'll talk a little bit more about NeuroSight towards the back end. We're also a partner organisation to what must be the best harm reduction website on the internet, www.drugsand.me. If you've not checked it out or seen it, do. I'm sure Ivan, who's the founder of Drugs and Me and NeuroSight, will put it in the chat just so people can click it and have a look. But yeah, do check it out. So let's do some introductions. My name's Paul North. I'm a director at NeuroSight. I'm also director at Holdfast, which is a non-profit advocacy organisation which seeks to reduce the harm of current drug policies in the UK. I'll just pass over to Arda.
Thanks, Paul. So my name is Arda, and don't worry about my surname. My background is in neuroscience, and that's when I got involved in Drugs and Me, and then I was just like, oh, the policy realm is so much more interesting, and I want to make a change. So I did my master's in science policy, and now I'm directing NeuroSight with Paul and Larry.
Hi, I'm Larry. I'm here representing Students for Sensible Drug Policy UK, or SSDP UK. I'm the current president of Durham University's individual chapter of SSDP, and I'm also the co-chair of SSDP UK's University Drug Policy Committee, which I'll talk about later.
And
great, cheers, guys.
Oh, yeah.
Oh, sorry, I had to comment.
I was just going to say, before we skip this slide, I wanted to thank Sabrina for making all these pretty graphs, if she's there.
Good job, Sabrina. Wicked. All right, Arda, shall I pass over to you and you can start to go through the survey?
All right, thank you. This is a webinar about the survey results. So there will be loads of graphs, and I'm hoping that you won't be zoning out because I can't see your faces. So I don't know if you are dying of boredom when I'm going through all these graphs. But anyways, to give a brief description of the survey, the survey was run between the beginning of November till around mid-December, and I'm sure you all remember that November was the national lockdown time. So our findings are mostly relevant to the lockdown time, plus the extra 2 weeks when the restrictions were slightly more relaxed. So we agreed on the content for this survey in consultation with SSDP and also Drug Science Student Society. In the end, it was a 38 question long survey, plus all the other demographic questions. So not massively long, but long enough that some students already dropped out in the middle of the survey. To make sure that we targeted all students and not just the students who use drugs, we offered Amazon vouchers. And in the end, our survey reached over 1,300 students, and we ended up analyzing just over 1,000 of them. Just to continue with the demographics, the most presented region was the northwest of England. and the majority of the participants were female, almost like double the number of males. Undergraduates made 75% of the participants, and we had a good representation from postgraduate. The rest was quite mixed, all sorts of foundation degrees and different certificates. And when we look at the age distribution, we see that around 87% of the participants were between the age of 18 and 23. The range was quite large, from 16 to up to 51. Right, so what does the survey results say about student drug use and their mental health? So we found that the drug prevalence was around 58%. And we usually don't report drug prevalence from our surveys because we usually have a lot of selection bias. However, this time I'm telling you the number because it was very consistent with NES is taking the HIT survey and our other in-house research. So I'm just like, wow, that 57, 58 just comes up a lot. And we found that the 5 most commonly used drugs were cannabis, ketamine, cocaine, MDMA, and nitrous oxide. I'll be referring to that as NOS.
Can I ask any questions after as we go along? Am I allowed?
Yeah, go for it.
So I know I remember we did this earlier in lockdown. How does this compare to the data that we'd gathered earlier? Like how would you contrast the two?
Thanks for asking that. I was just going to go into that actually. So the common drugs, that picture doesn't change that much, but in the first lockdown, we observed that the use of party drugs like cocaine and MDMA, they decreased. However, in this lockdown, the numbers were back up to the kind of usual prevalence. And cannabis use just seems to stay constant the whole time. It's just always high. And interestingly, NOS gained a lot of popularity. There was just a lot more use this lockdown. So yeah, we think that the increase in party drugs were because of the freshest parties that were going on in the first term.
In the chat about opiates, was it 3%? Opioids was 3% of the population. Is that right? And that's typical. That's pretty typical, isn't it? Like the student population tends to find. Deborah, I know you're saying you're from the US, Ohio, so maybe it's different over there, but it tends to be pretty low, isn't it? Whenever we've looked at this data. Yeah,
no, in the UK, in the student population, usually opioid use is little, because I think it's probably because doctors are a bit more careful with their opioid prescriptions, so there is less like opioid just circulating in the black market. So when we look at the frequency of use of these drugs, again, unsurprisingly, we see that it's cannabis, and it's always has the most everyday or almost everyday users. So here we see it's 29%. And similarly, 25% of cannabis users was using it multiple times a week. In contrast to that, again, unsurprisingly, MDMA was the least frequently used drug. It's the nature of it. You just don't use it very often anyways. And if we very quickly look at the other numbers, for ketamine, the users who use it like once a week or more was 27%. For cocaine, it was 20%, and for NOS, it was 15%. A very interesting part of this survey was we included a scale, a psychological distress scale called K6. And this scale, it's widely used around the globe by the governments to, screen their populations. And the scale asked respondents like how frequently they experience certain symptoms in the past 30 days. So things like feeling so sad that nothing can cheer you up. And like multiple studies showed its validity, and they've shown that having a score of 12 or more is a strong indicator of the presence of a diagnosable mental illness. And like normally, I hope you can see my cursor, but the peak is around here. You know, you usually see this sort of shape, but here you can see that it's shifted to the right. The average is really, really high. It's very close to the threshold with 11.4. And again, as expected, females' average is higher than the males. And in the rest of the analysis, we use this kind of high scoring group and low scoring group to categorize students. So we'll be using that as like low scoring and high scoring group. So this is what it means. We've also asked students about their mental health treatment status. And we found that 24% currently receive or will receive mental health treatment. And when you compare this percentage with the amount of students who were on the higher end of the spectrum, there is a big gap. And I think it's a good indication that there is an unmet need for mental health support. And we've also seen that mental health scores reflect the treatment statuses really nicely. So if you look at the table on the left bottom, you can see that students who will be receiving treatment had the worst mental health score. And it makes a lot of sense. And again, students who hadn't or won't receive treatment had the lowest mental health score. So these are the kind of psychologically more resilient students. An interesting observation we had here was the scores of students who received treatment in the past. They were still higher than the students who didn't need treatment, so the resilient treatment. So I think it's a good place to ask the question how effective the treatment is. This is not to say that like the number should be back to normal, but I mean, what do you think, Paul? You worked in treatment, and I think you have a better insight about this.
Yeah, I mean, I didn't say at the beginning, but yeah, I used to, before I come into the policy space, I worked in treatment for 9 years, and obviously, you know, I've always thought that addiction is a mental health issue. Like if you're using a substance problematically, the likelihood is that you're doing that for underlying reasons, something that you're using a substance because you want to change how you feel. So I'm not sure whether this is a reflection of treatment not being effective. I think the people that stating they never received treatment, that would be an indication that they don't feel the need to do so and don't have an underlying issue. And I think what this does for me is just highlight the complexity, if not of mental health as an issue, in that often it's not a case of you just going to treatment, whatever form that might be, and then suddenly you're like, oh, life's now great, I don't think about that thing. And I think a lot of mental health treatment services, it's more about managing a condition rather than it just suddenly disappearing. So I'm not sure it's a clear indication that treatment isn't effective. I think it's more an indication that people that haven't received treatment, don't need to do so, rather than those that have not getting a good enough score, if that makes sense.
Mm-hmm, mm-hmm.
But it's a good debate. It's a good discussion to have, particularly amongst the student population, because I think from working closely with unis and being involved in services that will go in and try and help students in a university setting, like it's really difficult. It's difficult to engage students when there's so much going on. And, you know, Arda, we know this just from working with universities in the UK, but there are just so many different wellbeing avenues that people can go down. You know, they can go to an external provider, they could go to a local, like a mental health service in the community, they could go to maybe a drug treatment service, they could maybe get private therapy, they could get some support from the university, they could get some support from a GP. Like there just ends up being so many paths that I think it easily becomes quite complicated and confusing. So I think it's a good question to ask. I'm just not sure the data is a clear indication of treatment not being effective.
Yeah. I mean, there's so many factors in the state anyways. Right. So we also asked students like if they had more reasons to, at least they thought that they had more reasons to use drugs more often this year. because we realized that some students kind of justify their drug use this year because they are bored, there's nothing to do, or their mental health is bad. And we found that 40% of students thought so. And in our surveys, we always ask, like, why students use drugs, what are the reasons? And this time we didn't just like ask what they use it for, but we kind of select the most common reasons from our other surveys and ask how often they use these drugs for these reasons. And when we look at the regular users, we see that the most common reasons were like to cope with boredom and like to help them go to sleep. Perhaps it's interesting and surprising to some people that peer pressure wasn't or didn't seem relevant to regular drug use. And when we look at these questions and kind of break down the answers based on the scores or mental health scores of students, we see a very clear relationship between the regularity of drug use and the state of mental health. So like the dark bars, for instance, are the students with the high mental score, and you can see that they make up a greater proportion as like the drug use becomes more regular. And I think it just implies that students with high psychological distress, use drugs more regularly to cope with their mental health. And I think this can be a like conscious decision. They might feel like, oh yeah, like cannabis is helping me, or like psychedelics is helping me, so I'm actively going to take it to help me. But it can also be a kind of subconscious behavior that evolved from recreational drug use. The body kind of learns that it feels good, wants more of it, or kind of it becomes an automatic self-coping mechanism that turns into self-medication. Yeah. So this is just another way of looking at the very same question. This time here we broken down it based on the regularity of use, and then we looked into these groups to see like what proportion of these users felt dependent. Because logically, regular use leads to more feelings of dependence, and this is what we've seen in the data for like every single sub-question. However, the reason why I put like 4 of them here is to kind of make the argument that when we look at the reasons related to mental health, such as anxiety or depression, I mean, I put sleep, perhaps not the best example, but you can see that the difference. So like the proportion of regular users who feel dependent is much larger compared to reasons such as, fitting with your friends. And this is just to show that dependency is more common among regular users if the use is related to mental health related reasons. And we also asked about students' access to drugs, because at the end of the day, it's been locked down, and for them to be able to use drugs, they need to be able to access it. And in the end, 78% of them reported that they found it easy to obtain illicit drugs, and this was despite the lockdown. We also found that half of students were involved in social dealing. So for those of you who don't know what social dealing is, it's basically supplying drugs to your friends, not necessarily with the intention of making money. Just the fact that half of students is involved in this is a very, very large number. And it actually, like when you calculate, it makes around 30% of all students. And I think universities should have clear policies about how to deal with such issues, because it's so common, especially for different classes of drugs. Also because like there is a lot of drug purchase on social media and the dark web, and as you can see the percentages there, 10% on the dark web, 27% on the social media. It's just social media makes drug dealing attractive, easy, like a easy money making route. And some vulnerable students, especially the ones who are struggling financially, it can be due to COVID, or they just want to finance their drug use. They might be easily seduced to dealing on social media too. I mean, Paul, do you have anything to add? Because you do a lot more work with social media and dark web.
Yeah, definitely. We did involve fast. We did a report on it called DM for Details. I'll put a link in the chat in a second. If people want to learn a little bit more about it, it was pretty groundbreaking research, actually. No one really looked into it, the extent by which drugs are sold on social media and what it looked like. So if people want to know more, that's a good place to start. But I think this is a particular concern to me, in that I think it's become really normalized among student populations to sell drugs to each other. And it wouldn't, I think for a lot of the students that we speak to, it doesn't really feel like dealing, because they're like, well, I've got access to the dark web, I've got Bitcoins, I just order more MDMA than I need, and I'll just share it with people that also go in on it. Like, it's not really dealing, I'm just sort of, yeah, we're all ordering it together. But when it comes to the eyes of the police, it's absolutely without a shadow of a doubt dealing with intent to supply. So, and that's a really serious offence. And one thing I always say whenever I get the opportunity to student groups on this is, if someone takes a decision to supply a friend or whoever with drugs, they are taking a huge risk in that if anything happens to that individual, and we know this, there's countless cases where this has happened, the police will absolutely find out who gave that person those drugs and sold them. And it's really easy to do by just grabbing a phone and speaking to a bunch of people. And it's such a serious criminal conviction. So, harm reduction advice is really important when it comes to dosage and times that people can take drugs, and that information is useful. But what is also useful from a harm reduction perspective is educating people on that transaction part of taking drugs. It's like, harm reduction isn't all about the use of the drug. It can often be about things that go on before, after, that have nothing to do with dosage of the drug itself. So really good harm reduction advice is, do not socially do, it's not worth it. If you don't let people pester you or say, oh, get me some MD, blah, blah, blah. If they want to do it, go learn how to get Bitcoin and go on that way. Don't really strongly advise against students doing that, because you do take a huge risk. And once you realize that, who wants to be at a party thinking, oh my God, I bought the MD that like 20 people here are on, and then worrying for the rest of the night that if something happens to them, you're kind of culpable, whatever the word is. So yeah, I think it's really prevalent. It's certainly a concern. It's becoming more and more normal. And I think it's really important that people get skilled up on it. So I'll put a link now in the chat if you want to find out a bit more.
Thanks. So yeah, to change the topic, we've also asked students how they start using drugs. And we found that 80% of students actually start using drugs before they are enrolled in university. And again, like, I think this has major implications for university policies, because when you think it's much easier to actually prevent someone starting using drugs than making them quit. I mean, just think like, tobacco use is easy to start, difficult to quit. And that's why I think absence-based policies aren't relevant to the majority of students who use drugs. I mean, they should be there, but there should be more than that, because they don't address to the majority of the drug-using population. And again, that's why like a harm reduction approach is actually more likely to successfully keep these students safe. And again, just to give a bit more detail, of the students who tried drugs before university, 27 of them still tried a new drug, while 10% wanted to but could not. So we also asked them why they, why they start taking drugs, or why they try it. Again, majority just out of curiosity, they were curious at that moment and wanted to try it. While 40% actually, actively planned to take it. while it was only 3% that felt peer pressure to try these drugs. So again, peer pressure doesn't seem to be a very significant factor. You know, when you look at these reasons, they are all about internal motivation, you know, less related to external motivation, like what, you know, for instance, earning money. That would be an external motivation. And when your behavior is directed by external motivation, it's kind of easier to change it. But when it's internally motivated, it will be much more difficult to change that behavior. And you know, it won't matter if the students knew all the harms, you know, they would still try, especially because so many other students, not only in their university, but globally, you know, are taking drugs like MDMA, ketamine, and cannabis. So once they know that, and you know, that it can be done without a lot of harm, they are just going to try it. And you know, at the end of the day, student populations, you don't see a lot of drugs being like heroin being used, because at the end of the day, students are aware that those drugs are a lot more harmful and a lot more risky, and they don't touch it. At the same time, the student deaths that occur due to drug use, we could say that a majority of them happens to kind of first timers or less experienced users, because usually the experienced users, they are aware of harm reduction advice, they try to practice it. And that's another reason why it's really important to give harm reduction advice to the whole university population. Again, this is just another number you can see on the screen that shows that people are still want to try other drugs if they have the opportunity. So we've talked about how students start taking drugs, and this is about kind of how the drug use ends. So you can see that 1 in 2 students actually had a negative experience. And when we look at the detail, it's 30% of the students who used drugs felt dependent, 13% felt withdrawal symptoms, while 8% felt addicted. And when we asked this question, we did provided them with the definitions, because as you might be aware, dependence and addiction usually are used interchangeably. But here we wanted to mean different things. Anyways, but I also wanted to point out that these are self-reported answers. So it's very possible that actually most students, you know, are dependent or might be suffering from, you know, subtle withdrawal symptoms without realizing that it is because of their drug use, because it's so subtle. You know, maybe it's manifesting itself as just lack of attention in their lectures, and they just think, you know, it's just the way it is, and they don't make the relation that it's because of their drug use.
I'll just jump in, Alec. This is the bit that stresses me out from working in treatment, those stats. It's like, I can tell you now that the vast majority of those people that are self-reporting symptoms of dependency, withdrawal, and addiction absolutely don't access treatment services. And the reasons for that are complicated, not only looking into like I don't know, just the state that people get, you know, their knowledge and awareness of treatment, but also the way in which treatment services are understandably focused on the heroin cohort. So I think a lot of my career, particularly towards the end of it, was spent banging a drum about how treatment services need to open their eyes to new cohorts outside of those very vulnerable and you know, groups that obviously do need care. But I think really what I've learned in the past couple of years is this pressure really needs to be applied on the universities, not treatment services. I see it as the university's role to flag existing treatment services and providers that exist and encourage students to go and get help and formulate pathways to get students into structured like support services, really. And I guess that's a lot of the work we've been doing over the past few months with a few different unis, is sitting with people in universities and going, right, how can you ensure that students at your university that are experiencing a problematic relationship with drugs, how can you ensure they get help? And that not just being as simple as, well, we've got a wellbeing service and we like to put some posters up. It's not enough. You have to have clear systems by which you could, when these students experience those feelings, those symptoms, that they can get support. Because they're the stats that worry more than anything else, really. Like 30% feeling dependent, 30% withdrawal, 8% addicted is will not be the percentage of people that are accessing treatment services. And that stresses me out.
Yeah, and we have more worrying results here. I mean, some people who were actively reading the slide probably already read it, but 16% of the students had a scary experience, but actually didn't ask for help. And I think this is extremely worrying because, you know, I mean, students don't ask for help because they are worried about being punished. They are worried about experiencing, you know, consequences that would be bad for their academic career or career in the future. I mean, in some universities, it is the case that it's a problem, but in a lot of the universities, it's okay to report that, especially if you are in trouble, you won't be punished. But students don't necessarily know that. They are not aware of that. They just have this assumption that drug use, you know, will be punished. And I think universities should make sure to communicate that. You know, communicate that they can get in touch and they won't be in trouble if they do. Yeah, and again, other percentages on the screen, 12% was concerned for their safety, while only 1% had been to the hospital. Yeah, I think that was almost all the data we had describing the situation. Kind of giving a kind of picture of the situation. Now, I'd like to talk to you about how you know, how we can design tools or policies or interventions that are actually relevant to students' needs and worries. I mean, student who uses drugs. Right, so we've asked students this question, what aspects of their life they think is affected most negatively by their drug use. And you can see that, again, perhaps not very surprising, the first three were finances, academic work, and mental health. And I'm going to make the very obvious statement that, you know, when universities trying to communicate messages to discourage drug use, they should try to include statements related to these three categories. Again, it's easy to say, so I will try to give some examples. So, for instance, about finances, you know, if you are, I don't know, holding a workshop or a webinar in induction week or whenever, as an activity, you can make students reflect about this issue. So you can, you know, ask them something about they want to buy, or you know, then you can make them calculate how much of their drug use they have to sacrifice to be able to buy that thing. So, you know, it's just to prompt some reflection. And similarly, you can also share information about how drug use affects their executive functions and how it is relevant to their academic performance, especially messaging on social media, because this is where young people are, is a good way of reaching more of them. And in terms of the mental health, I think, I mean, when I look at the university's websites and look at their sources, a lot of the time, the resources related to mental health, they don't necessarily make the connection between drug use and mental health. So I think drug-related issues and information should be integrated into that category on universities' websites or unions' websites and resources. We asked the same question, but this time we asked like how their drug use affect them positively. And here, again, I guess the first one is very obvious. You know, just like alcohol is like a social lubricant. It just enhances people's you know, relationship with their friends. But then we also see that mental health is in top 3 in both graphs. So it's almost like, you know, drug use both makes and breaks mental health. But it also means that the mental health related reasons are the easiest path for drug use to become problematic, because, you know, students might start using drugs, or at least might make their drug use more regular, thinking that it's helping their mental health, and perhaps it is helping their mental health at first, but then in the long term, it's not. And yeah, it's just they should be aware of it, and that's why educating students on things like, the implications of drug use for their mental health, or signs to look for to spot such problematic drug use is really important. So at least now they just like okay, maybe not alcohol is a good example, but like before their drug use becomes problematic, at least they know what to look for. At least they have, they have an opportunity to interfere with that process. Also, like, we shouldn't ignore the social aspects of drug use, because, in the literature of behavior change, if you want to, change that behavior, it's much more easy if you introduce an alternative behavior to substitute that. So in that case, again, the obvious conclusion is that universities should do their best at organizing events, social events, engaging events. And I know this is easy to say, but it's difficult to do, especially during COVID. We also had the same problem that, you do an event and students just don't join, they don't want to engage, they don't care. However, it is still worth trying. I was trying to come up with examples, and the first couple of examples that came to my mind. So I came up with one example for non-COVID times, and this was so imagine a student bar. I thought you could put a jar with maybe little like papers that has little conversation starters or interesting things to talk about, and like every time a student goes to the bar to get a drink, maybe that person can pick something from the jar, and if it is an accepted thing, it's not going to look weird, but it might indirectly reduce perhaps alcohol use or perhaps other drug use, because you're kind of facilitating the social interaction. So perhaps the student will feel less anxious about the social environment and maybe end up drinking or taking less drugs. And I was trying to come up with an example for the COVID times. I really struggled. And one thing I came up with was on Friday nights, for instance, because I think one thing students are missing is like that vibrant environment, whether it's in a student bar or another bar, or just like that engagement they get with random people, meeting new people. And a lot of first-year students didn't get that opportunity, and it's really frustrating. So universities perhaps could organize online events, maybe on Friday nights. And this online event would just be like a virtual bar. So I know that Zoom or other platforms, they all have breakout rooms, and students, just like tables at a bar, could like randomly go to these breakout rooms and randomly talk to people. And I know that things can get quite messy. So to kind of regulate the environment, maybe the security or someone responsible can just like from time to time visit these breakout rooms, just like a security would visit the bar. Anyways, that's enough me waffling, I think, on this topic. But if you are struggling, just email us. I'm full of ideas. Right.
Yes, I've been trying to answer a lot of the questions. People have been asking loads of questions. I've answered a bunch on the Q&A tab, so people can click them and just look. But there are also some that we'll take through and answer at the end as well. So thanks for the questions. Keep them coming.
Okay. Yeah, because I'm sharing my screen, Paul, I can't see the chat. So if there's like something very relevant that can be answered quickly, just please highlight it for me.
Or you can answer, if you're good for time, you can answer these ones now because they all relate to what you've been talking about. You can wait to the end, it's up to you. What do you ever do? We'll just wait to the end. Keep people,
okay,
keep people on the edge of the seats, Arda, with the questions.
Yeah, we'll just wait till the end. Okay, so we also ask students about like what sort of harm reduction things they are considering before they take drugs. And if you look at this graph, you'll see that students seem to be thinking about everything. But of course, this doesn't mean that they have the right or complete information. If they are thinking about how much they'll be taking or how much is safe, maybe they don't have a very good idea that how much is too much, or they might have misconceptions. Again, it's just the beauty of self-reported data. But I like to have your attention in the last three, the bottom three options. So students aren't thinking about when they'll stop taking drugs more, what they shouldn't be doing while under the influence of certain drugs, and how frequently they can take it without risk of harm. And this makes me think that the contrast between like positive feedbacks and negative feedbacks, because like drugs, they create positive feedback mechanisms in your behavior, in your thinking processes, and that's how it reinforces your behavior. That's why you want to keep taking drugs. And to counteract that, we need to introduce students some negative feedback mechanisms, ways of thinking that would act like a negative feedback mechanism in their drug taking behavior. Again, it's easier said than done, but I try to give some examples. So in terms of like when you'll stop taking it more, we have that, anyone who drinks alcohol kind of learns when they should kind of stop drinking, or they should like start slowing down because of how they feel internally. Of course, such, that doesn't always exist, or that's not spoken, especially new users just might not be aware, and they might just like end up taking loads of drugs. So a way of doing it is to communicate information like the one you are saying. So for instance, for ketamine, because it's powder, students tend to snort it, and it like you are able to regulate how much you are taking as opposed to a pill, because you just take it once and then it's either a high dose or not enough. So like, yeah, you can try to communicate internal feelings to look for, but when it's something like a pill, you can communicate messages around like how much they can wait until they need to, they want to take again. Because like with things like MDMA, maybe students will find, oh, 2 hours is so long. But then the problem with MDMA is usually the derivatives, such as like MMDA or MDA, they start kicking in later, but then their adverse effects are much worse, and that's where the harm comes from, and people end up overdosing because they just retake. So those messages are really, really important to communicate. In terms of like what they shouldn't be doing, I think the very first thing to communicate is do not accept challenges when you're on drugs, especially on drugs such as cocaine that makes you feel so much more confident. Just don't. And when it comes to like how frequently you should be taking a drug is, again, just play it on the things that students find annoying. Like, oh, are you sick of calm downs? Well, if you don't take it in MDMA more regularly than every 3 months, then it's much less likely that you'll be experiencing calm downs. And you never know, that might lead to some reduction in drug use, and any reduction in drug use is a reduction of risk of harm. So I think it all adds up in the end. So yes, I think a lot of people now are aware of scaremongering, not is how to pronounce that word, I'm not sure, but scaremongering not working very well. So here I just want to highlight that like majority of students who use drugs, they already made their judgment about if it is worth the risks. They think it is worth the risk, when they want to take the drugs, and they have, they made that judgment from first-hand experience. And once they've done that, I think it's really, really difficult to change their minds. Again, similarly here, only 33% worry about the short-term effects of drug use. It's just to show that scaremongering doesn't work, because students already made their minds. Just another stat. So I need a glass of water. Right, so if we are not going to scare students to reduce their drug use, what are we going to do? Well, like we always say, harm reduction. But to look at the details, we see that 64% of students, they actually worry about long-term effects. I personally found this interesting because when we work with younger groups, we usually, the school children, we usually tell teachers or parents that they should focus on the short-term effects because young people usually find short-term effects more relevant. Long-term, they don't really care. I mean, why I should be worrying about 50 years ahead, right? But here, it seems to be the case that students worry more about long-term effects. I think that might be because, they already experienced the short-term effects and maybe, they know it's not catastrophic, but there is a lack of research regarding long-term effects. And I think the uncertainty is bothering, students who use drugs. And in relation to that, actually 82%, and that's a very good number, 82% want to learn about drugs. So there is demand to learn about them. And again, like as I mentioned previously, like if they are aware of the harms, it will contribute to their decision making. Maybe that it's not necessarily going to make them quit, but it will definitely help them keep safe. Again, another question we usually get from universities is like whether they should inform all students or the students who use drugs. Again, if it was for the younger generation, usually a targeted approach is much better. So you are not introducing, students who haven't heard of drugs to really detailed drug information. But in university, because most of the students already started using drugs, or it's just so common, or you'll definitely come across to someone taking drugs in front of you at some point. So I think it's really important that the education is given to everyone. Again, just to make that case stronger, I want to highlight the last two bars in the graph on the right. So the difference between the amount of students who know what to do if their friend has taken too much of a drug or too much of alcohol. I mean, that difference might make the difference between life and death in certain situations. It's just like first aid. When drug use is so common, it just makes sense to know about it. And I think another nice encouraging finding was the fact that students take their peers very seriously, because just because of the way drugs have been handled, students don't see universities as a credible source of information when it comes to drugs. They just don't trust it as an authority in this field. However, when it comes to talking to their friends, whether it's talking to someone about their well-being, or their friend talking to them about their own well-being, they take it seriously. I mean, look at those numbers. And universities should take make use of this, exploit this situation. And a good way of doing it is training certain students, who are already interested in giving such support. You can train these students about drugs so that they can provide confidential support for students who don't want to talk to the university's own services, maybe or their supervisor. But when they talk to a peer, they know that it's not necessarily going in the records. They won't tell to any teacher. And yeah, they won't at least be afraid of being judged or being punished for it.
Can I just jump in a moment, Arda, and say that this is something that's actually happened to me? I've had people call me while on drugs asking whether they should call an ambulance before they actually call the ambulance themselves.
Oh, wow. Yeah, and SSDP provides peer support and training like that, right?
Yeah, we do mention.
You'll be talking about it.
It happened on there was a Facebook group a while ago. I remember we were chatting about when I was volunteering at the Loop at Boomtown one year. That this safe safe. I think it got deleted now. I might have spoke to you about this. You might remember the name of it. It's like Safe Sesh, and it was this it became this like massive Facebook group. Vice did an article about it, where there was loads of people basically going on and just sharing like harm reduction advice. It was quite well moderated to start with. It was decent, but then it just got like wild. It got shut down because the amount of people that would post on the group and be like, "Oh, my friends they've taken some MD, but they kind of look a bit white. I'm worried, and they're not really responding. Like, what do people think we should do?" And it's like it became so dangerous because it was kind of encouraging, like, "Oh yeah, come on and kind of chat to people and bounce around ideas." But it just emphasizes the need to provide like good drugs education. Arda and I were chatting about this the other day on like a working group that we're a part of, about, you know, we've got a lot better at sex education, recognize that like there's absolutely a need to educate young people on sex. Like, it's just a fundamental part of the PSHE and education system. We need to do the same thing with drugs, so that, you know, we need to accept that students get access to drugs. They're pretty common in the UK, regardless of what people think of current policies or their views for changing that. The reality is drugs are exceptionally easy to get, so we should accept that and put systems in place to say to students, right, look, this is what you need to know. There's some really good, I'm chatting to a few people in the answering questions and stuff, but really good point being raised around universities' fears of being open to these kind of discussions, and a natural tendency to go for zero tolerance approaches, which obviously, that to me, that's the input, that's where the tension lies, you know, because universities will say we can't create discussions which encourage or condone drugs. Obviously, that's not the case with harm reduction, but I think that sometimes that's a little bit of the elephant in the room when we have these discussions, that unis naturally become quite tense and concerned about that, because they, you know, they'll whack all over their website or have the policies, you know, this is zero tolerance, but unfortunately that leads to these situations that have been outlined.
Mm-hmm. Thank you, Paul. So this is my last slide. I'm aware that you are sick of me by this point on my graphs. As well, cut this one short. This is just to, again, give a bit more example about like that point I was making about substituting or giving alternatives to the behavior that you want to change. We've seen this graph on the left, and I was just going to give examples for the first two reasons, so coping with boredom and helping go to sleep. I was basically just going to say that universities can provide more resources around sleep. Hopefully that might help reduce some drug use related to sleep. And in terms of like providing entertaining and engaging events, I'd like you to have a look at the graph on the right. So when we ask students about like what helped them best to support their mental health, we see that like cooking and video calls and engaging physical activity, they are at the top. Again, one idea I came up with for cooking and eating well was, I'm sure so many students from, you know, different countries, they'll be more than willing to talk about their cuisine, or even maybe like share some recipes that they're cooking online. And such activities can be, you know, organized online virtually, and it might be, you know, an interesting, engaging way to, I don't know, prompt students to eat well, but also, you know, just engage them, give them to do something, make them cook. Anyways, yeah, I think that's all I have to say today. I hope you found it interesting. I'll now pass it to Larry.
Brilliant. Well, thank you, Arda, for that interesting information. For those of you who joined late, I'm Larry, and I'm the current president of Students for Sensible Drug Policy Durham, or SSDP Durham, and I'm also the co-chair of SSDP UK's University Drug Policy Committee, which is comprised of a group of students from all over the UK who are committed to reforming punitive drug policies and campaigning for improved harm reduction strategies and wellbeing support on campus. We believe that harsh drug policies or zero tolerance policies in university create this culture of fear amongst students. Students fear seeking help from the universities, and as a result of this, mental health services and drug education services within the university may not feel any pressure to reform themselves. So when we look at the survey's findings on student opinions on how services provided by the universities cater to those who are struggling with their mental health or using drugs throughout the pandemic, there appears to be an overall lack of student satisfaction with the current support that's available to them, which, when coupled with the survey's earlier findings, suggests that improvements are not only necessary, to protecting students' mental health during this really difficult time, but are also in demand amongst the student population. As Arda said, 82% of students want to learn harm reduction techniques and strategies. So as we can see from the pie chart on the top, when asked whether their university had provided any additional wellbeing support and advice regarding safeguarding their mental health during the pandemic, only 42% of the respondents stated that they had actually been made aware of such services, signalling a lack of signposting and a lack of university emphasis upon student mental health. And furthermore, when they were asked to review this support, the support that had actually been offered to them, students gave an average rating of 40.1 points out of 100, which suggests that universities' attempts to safeguard student mental health have been worryingly insufficient during this period. Furthermore, when discussing drug harm reduction within universities, on the next slide, sorry, Arda, only 19% of students said that their university had provided them with any safety information whatsoever regarding illicit drugs, which, as Arda has just shown, more than half of all respondents to the survey have been using since the start of term. So as we've seen from the stats in the earlier half of the presentation regarding the relationship between student mental health and drug use, these university services are clearly lacking in a time when they are actually quite needed. So if there are any students here or any staff who want to help with this issue, I'm going to talk about a network of support that's currently available to students all over the UK, regardless of whether there's one in your university, and that is SSDP's UK network. So as I've mentioned before, SSDP UK is part of an international organisation, a grassroots organisation, which operates in the form of international networks, such as the UK network, and also in individual chapters or communities, in universities or communities. And as an organisation, SSDP believes that the war on drugs is a war on us. So instead of advocating for punitive drug reform measures, we take a harm reduction based approach, trying to combat the negative impact of drug misuse upon individuals and communities through harm reduction strategies. Now, as an organisation, SSDP doesn't condemn or condone the use of any legal or illegal drugs. We simply believe that individuals should have the right to make their own decisions regarding their own health and well-being. So, over the first lockdown of 2020, we brought the formerly defunct SSDP UK network back to life. When I say we, I mean the brilliant Dasha Anderson, with the help of a collection of chapter leaders from all over the UK and members of different university chapters who wanted to coordinate nationwide action and carry out SSDP related aims and objectives regardless of the pandemic, and also with the help of lots of individual students in the UK who didn't belong to a chapter, didn't have one in their university, but were still really keen to get involved with SSDP. So while we were working together over the summer, we used engagements with the national media. We started up lots of partnerships with the organisations you can see listed on the slide, including NeuroSight, of course. And we also used the wonderful world of social media to boost our public profile, which then allowed us to expand our membership, gain some attention. And as our network expanded, we were able to set up individual committees, such as the Drug Education Committee, the University Drug Policy Committee, the International Drug Policy Committee, just to name a few. There are so many, because as we've got lots and lots of different aims and objectives, we understand that this is pretty much impossible to organise through one network alone. So we've set up these individual committees to which responsibilities will be delegated, and members are free to join these committees according to their own interests and experience. So, for example, me personally, I joined SSDP with a background in student activism. So it made sense for me to join the University Drug Policy Committee, which facilitated lots of different actions during the pandemic last year. So, oh, sorry, Arda, you've skipped. Is it okay if we go back another slide? Sorry. Thank you. So we organised a university drug policy review where we ranked different university drug policies based on which ones we thought were most effective and which ones needed the most work. We also took part in the NUS Drug and Alcohol Impact programme. We were asked to review the criteria and suggest any improvements. And members Dasha Anderson and Hannah Head have also been compiling a SU testing kits toolkit, which students' unions can refer to if they should wish to introduce testing kits to the university. We've also taken part in lots of international campaigns, such as #SupportDon'tPunish. As you can see on the slide, there's pictures of members, myself included, holding up stickers because we did a big sticker campaign going around major cities, raising awareness of a campaign, which actually coincided with the Black Lives Matter movement over the summer. So this provided us with a really crucial talking point regarding the racial implications of the war on drugs. And we also held lots of webinars over the summer, such as one with Decarceration Nation, the American anti-carceration organisation for Support Don't Punish. And we liaised with CREW and lots of academics, such as Dr. Larissa J. Meyer, for the International Overdose Awareness webinar we raised. So in terms of how students can access us, my main advice would be to join our Facebook group, which is called SSDP UK Network, where we share updates on events that we've got coming up, such as training, such as webinars like this one. We also broadcast lots of opportunities, such as training and careers opportunities to those who might be interested. We host meetings between chapters so that our members can discuss our progress, meet with each other, kind of keep in touch, and also support people who are keen to start a chapter. But as I've said, if you don't belong to a chapter, you're more than welcome to join in with us. If you're seeking harm reduction information, you can also access this from our social media. So we've used social media to disperse a Freshers Week pack that contained information as to how to stay safe at university. On Instagram, we often provide little picture cards with harm reduction advice regarding individual drugs and general drug safety. As the network's TikTok sensation, I can say that we're operating across lots of different platforms. So whatever social media you're on, you can probably find us. Now, despite social distancing regulations, I can confirm that individual chapters have done their absolute best to remain active by whatever means necessary. So, if you go on to the next slide, sorry, Arda. Thank you. So, for example, in we
Oh, I think we lost Larry there.
Oh no, she's frozen in. She's frozen in time, suspended in time, keeping us all in suspense.
Oh,
So
no.
give her a second to jump back in. Ada, we'll take this opportunity to answer a question.
Yeah, go on.
Is that all right? Do you know how the data surrounding access to drug use differs compared to other non-COVID surveys, e.g. Take the Hit? It does seem like drugs were easier. Did it seem like drugs were easier or harder to obtain?
Well, I mean, our question doesn't tell if it was easier to or harder to obtain compared to other times. It just asked like whether they found it easy to obtain it, because it was like a Likert scale. So we've just given the percentage that either strongly agreed or agreed with the statement that said, I find it easy to obtain drugs. So it doesn't really tell a comparative kind of, so, you know,
Yeah,
compare it with, yeah.
I guess what we've heard from chatting to students is like there's certainly like there continues to be pretty proactive marketing campaigns from dealers around getting access to drugs, like the whole sort of like flyering, giving business cards out and stuff, and constant WhatsApp spam. Definitely suggest them. I was an anonymous attendee who submitted the question, but definitely suggest you check out the Fast report that I posted that sheds a lot of light on like just how easy is it at the moment in like 2020, 2021 for students, young people to obtain drugs.
Mm-hmm.
Another question was from Dasha. As I imagine drug users were overrepresented in this sample, selection bias probably means drug users are more likely to answer the survey than non-drug users. Welcome back. So we're just taking the opportunity to answer a question while you jumped out. I'll just finish with this. Do you think it could be possible that mental health issues were high in this sample because the sample is a sample of people who use drugs and drug use is closely linked to mental health anyway? It's a good question.
That's a really, really good point, Dasha. I mean, as I said at the beginning, our surveys always are affected by self-selection bias. It doesn't matter whatever incentive we give to students, it's just because of the platform students follow that usually it reaches to drug using populations more. And it is true that those populations usually struggle with mental health more. And it seems to be the case that, I mean, commenting on causality of this is difficult, but it's just usually thought that drug use causes bad mental health. But a lot of the time for these students, they end up using drugs, or at least end up using it problematically because their mental health isn't great. So in that case, yes, I agree that it's very possible the students with worse mental health was overrepresented in the scale. Thank you, Dasha.
Cool. Yeah, good question. Cool. We'll hand back to you, Larry.
Thank you. Sorry, I don't know what happened there. I think it's just my awful Wi-Fi. But where was I up to? Oh yeah, so talking about actions that we've got going on in our individual chapters. So although we've had to suspend our in-person activities due to lockdown, SSDP Durham is still active, still going. We're organising a zine, a harm reduction zine to give out, and we've been campaigning for the introduction of testing kits in our student union. SSDP UCL have also been absolutely amazing with organising events. We co-hosted one on the subject of drugs in the environment last term, and they've recently had hosted some guest speakers, such as the Navigating Career Opportunities in Psychedelics event, which people are free to attend regardless of their affiliation to any SSDP chapter. And talking about chapters, we've had loads and loads of new chapters pop up just at the start of the year, actually. So for example, KCL, Newcastle, Surrey, Huddersfield, Queen Mary, Bristol. It's just amazing to see all these new chapters popping up and SSDP starting to spread thanks to the revival in the network. Now, I'm sorry, if we move on to the next one, please, Arda. Thank you. So if you're listening to this and you're thinking, oh, amazing, I want to start up a chapter in my university, all you have to do is contact SSDP's international office and meet at least 2 of the 3 main criteria, which is to receive official university recognition, host regular meetings, and attend national and regional events. Now, if you're struggling to get together a group of people in your university, if there doesn't seem to be much of a demand for harm reduction, then you're free to participate in SSDP UK regardless. You can join committees. We do have people who don't have a university chapter, but are still really active and crucial members to the network. Now, as for the personal benefits of joining SSDP, I can honestly say, this is a bit cliche, I know, but SSDP really has helped me to grow and develop as a person. So me personally, I have no background in science whatsoever. I came into SSDP for the activism side of it. But ever since I've been really heavily involved in SSDP, I've read David Nutt's book. I would never have read a science book before. And I can now have really informed conversations with drug scientists and people who are interested in drug science about things like drugs in the environment, research into drugs. And I feel a lot more confident giving out harm reduction advice now than I was when I first joined SSDP, just because being part of the organisation, you learn so much, you learn so many little things. I'm still learning today. And also one of the major benefits is that through SSDP, I've been able to become friends with so many amazing people who are really passionate about harm reduction, really passionate about drug policy. And I just can't wait for lockdown to meet, so the little SSDP UK family can all get together and have a proper in-person catch-up, which I think we were all really, really hoping for at some point. And also SSDP provides lots of opportunities to develop your own personal interests, which I think is brilliant. So me personally, I love writing, and SSDP's provided me with so many opportunities to write articles for publications like Voltfast, Drugs and Me. If you want to become a TikTok sensation like I have as well, we can provide that for you. We've got loads of positions going. We always need someone to help us run social media. And we've also got on offer, now this is a good one, the Psychedelic Career Mentorship Pipeline Scheme, which is a fully funded mentorship program designed to help SSDP members get pathways into psychedelic science research careers, which is only available to SSDP members. So definitely a positive that we've got going for us. Now, just to wrap up, in terms of what's next for SSDP UK, we're currently undergoing a major restructuring. We're hosting board election members to elect a new committee to run things. These nominations are closing next Monday. So if you're interested in getting involved in SSDP and doing a bit of leadership for us, please do nominate yourself. You can go to our UK network to find out more about this. If you're also interested in starting up a chapter, I'll put my email in the chat bar so people can contact me if they want. And definitely join our network anyway, just to be filled in on upcoming events, training, and follow us on social media.
Lovely. Thank you, Ellery, for telling us all about SSDP and all the amazing things that you do. Paul, would you like to tell a bit more about what we do? I feel like I talked a lot during this.
Yeah, I'll do a quick ramble. Yeah, so NeuroSight, we've been around for about 2 years. Initially, we came out of discussions and thoughts around, I guess, professionalizing harm reduction. One of the things that's difficult about harm reduction is there are a lot of people that care deeply about the subject, and as hopefully we've highlighted, not just today, but in a lot of stuff that we've been doing over the past couple of years, there's a big need for universities, education institutions, well, not just universities and education institutions, but a wide range of groups to recognise the importance of harm reduction in the workplace or in the place of education. And a lot of these conversations, the reason NeuroSight came about is we were saying, well, what this industry needs is professional services that universities can work with and private businesses can work with to bring in, because up until now, really all it's been is people sort of doing bits and bobs and being passionate about it. So NeuroSight was born out of that intention, really. And what we do is a wide range of things that we do. We'll do research in organisations to identify what populations are doing, how they're using drugs. We'll do reports. We'll get quantitative and qualitative information about different populations, like we've done today. But then, crucially, we'll work with organisations to make that relevant. So we'll find out what the need is, and then we'll put a system in place or a pathway in place to help people get support with it. So we'll do talks, workshops, training, campaigns, not just with unis, but a whole range of organisations and businesses. We also do a lot of stuff at the universities, even for like social workers, do like training for social workers, people that are kind of studying certain subjects. So lots of stuff like that. And also, I guess the other thing that we do quite a lot of is kind of policy analysis. What we tend to find is these three things all to tie in together and work as one package. So most of the universities, education groups that we work with, we'll do a little bit of research, a whole bunch of talks, workshops and trainings for staff, and then we'll write a policy that kind of links it all together. And this will get better in years to come as harm reduction. Like, this is just, I will put this on paper or on video, whatever we're doing. That, like, this is just the start for the harm reduction movement. I think that what we're doing now, the people that are passionate about this are kind of paving the way. I think in 5-6 years, it will be completely normal to have organisations and groups like NeuroSight. Harm reduction will be professionalised, and it will be a completely normal area of work and business. But what we're doing at the moment, I guess, is kind of tying it all together and putting it in one package. So a typical piece of work is we'll come into a university, do the research, find out what the need is, put in a load of talks, workshops, training and campaigns to get the message out there about reducing harm. And then to tie it all off, will help write the policy so the whole thing makes sense. Because often what's kind of happened historically is a uni will be like, oh, well, come do a talk. And they just do like one random talk, or come train the wellbeing staff and just do like one piece of random wellbeing training. But if people kind of look at the questions that have been asked in today's chat and the comments, it kind of highlights a need for something that's much broader than that. Like, it's no good just doing one talk for one group or for 4 members of a wellbeing team. You really need a whole policy that brings this stuff together. There's some really good questions and points that are being raised around the issue of zero tolerance. And for me, this gets to the heart of the problem. If you have an education institution, or not even just education institution, an organisation, it could be a private business. If you have a policy that's like, well, it's zero tolerance. We don't, you know, if you disclose using substances, we take that very seriously, and that becomes a problem. Well, guess what? No one's going to disclose anything. The same thing happens in secondary schools, which have will immediately tell the parents a policy and approach. Well, it's essentially what that means is why would the kid ever tell a parent, tell a teacher before telling a parent? What's the point? So you just disclose to the parent that you use substances for them to then tell the teacher for them to then tell your parent. Why would you ever disclose it in the school? So really what I like to think NeuroSight's main role as is to work with people that are passionate about this in organizations like universities, to help get the university and key people to a point where they'll say, oh yeah, okay, that zero tolerance approach is probably not the most healthy thing. And one of the questions that's been asked, a pretty good question, was around kind of like harm reduction and like how can you get universities to include it in the policies. And I honestly think that's one of the biggest challenges. It's about the misconception that exists around harm reduction. Unfortunately, the way in which it's sometimes talked about in the media or perceptions that exist around drugs mean that people think that harm reduction is a pro-drug use stance. And it's kind of like, well, if we adopt a harm reduction policy, then that means that we're telling people to use drugs. And it's just completely false. Of course, like there's an element of honesty when it comes to harm reduction. It certainly involves saying to people, if you do choose to use cocaine, here is some information that will keep you as safe as possible. But what that sentence finishes with is also like, but there's still a risk even if you follow this advice and this guidance. So a lot of the work that we're trying to do at the moment is working with organisations to better understand what harm reduction even is. And I think when you have a sensible, nuanced conversation with professionals that care about students' health and well-being, you get to a place where, you know, people ultimately want to reduce the number of student deaths that are occurring and reduce drug-related harm. And certainly the groups that we're working with at the moment, there's been some really positive moves and steps. So that was a long ramble to explain what NeuroSight is, but I hope it kind of sets the scene that I truly think, and I don't, this isn't like trying to inflate any egos or anything, but I truly think that these kind of discussions and this sort of work is the start of something. And that's why I'm such a massive fan of SSDP and the work that's gone on there in the past couple of years, because what we're really doing is we're laying the foundations to stop student death, not just student deaths, but deaths of people due to drugs, because it's so frustrating and sad when it happens, because it's also preventable. Whenever we get a drug-related death, it's pretty much every time down to someone not having the information and the facts. And I truly think that the conversations that we're having now and what we're putting in place will normalize this discussion, and as it should, because, you know, students are dying. It sounds really cliche, and, you know, it sounds a bit daft, but like, but students are dying. So the price for us not getting this right is high. That was a real ramble. That's what you bring me around for, Arda, to do some long rambles.
I guess the main point is a systematic approach is necessary because it is a complex problem and it will take time to.
I should have just said that. That sounds well good. I could do that next time.
Right.
Do more of that. Questions and answers. So we do have a few that were unanswered. Elisa, I maybe answered that question then about a definition of harm reduction and what universities should include in the policies. I mean, the definition of harm reduction. Oh, there we go. You said answered it, and I won't go another ramble. But I think the main thing for the moment is universities should not have zero tolerance. That's the main thing. I think getting universities to adopt harm reduction language in their policies right off the bat is a big ask, but certainly getting them to remove zero tolerance chat is a good first step. Someone's asked, are there chapters within Welsh universities at all? You got any Welsh chapters?
Not currently. I am Welsh, and there's nothing at the moment.
That was from an anonymous attendee, but if you were someone who can make that happen, then get, you know,
oh yeah, please.
Reveal yourself, speak to the guys. Anne-Marie Joyce, for Larry, is it suitable for uni staff to join SSDP groups, or do you think it will be putting off students if their new staff were in the chapter?
So in terms of groups, I'm not sure whether you mean individual university chapters or whether joining SSDP as a whole. But I would say, yeah, absolutely, come along. I mean, we are always grateful for staff support. Really makes a difference when we're pushing for changes within the university. Often, I think you'll find in an individual chapter when they're hosting events, we do this in Durham. If we want it to be student specific, we'll put a little note saying this event is for students only. But no, absolutely, if you're a staff member who's keen on getting involved, that would be really, really beneficial to whichever SSDP group I think you're going to be approaching.
Wicked. That one's answered. Someone's asked, what about naloxone training? Right, I know a guy called George Charlton who is literally an absolute legend. If people are interested in harm reduction, passionate about this, which I assume you are, stay to the end of the webinar about it, then you must check out a guy called George Charlton. I will get his Twitter handle and I will put it in the chat. He's doing loads of amazing stuff on naloxone, and he's part of a program which is tasked with educating people up and down on the country of the benefits of naloxone. So if you're interested in naloxone training, he's a great start. He will no doubt come and help you out. So I will get his Twitter handle and I'll pop it in Twitter in a second. So I've answered that one. As a student, can I get properly involved with NeuroSight SSDP? Well, 100%, yeah, of course you can. I mean, SSDP are a great start for that. Follow the links, follow the Facebook. You can absolutely get involved, 100%.
Getting involved with SSDP, I'd say join the Facebook group called SSDP UK Network. And if you put a post saying, hi, I'm new to SSDP, how can I get involved? We can invite you to our upcoming meetings, and because we'll be having one soon. And also put yourself forward for board member elections if you want.
And you can always send us an email. I mean, we do a lot of things together, SSDP and NeuroSight. So if you are part of one, you'll probably be involved in the activities of the other.
And thank you to Dash for sharing the links down below.
Yeah, big time. I'm just getting George's Twitter handle so I can put it in. Said I would. Yeah, if people are passionate about harm reduction, check out George on Twitter. Follow me on Twitter as well. I just need more followers. Thanks. Cool. We've answered all the questions. I don't think there's anything in the chat that I missed. Going back up. So we've actually finished the webinar on time, which is amazing.
Yay.
I love webinars that finish on time.
Yeah.
Thank you so much to all attendees. Really appreciate the questions. Really appreciate people taking the time out to listen and hear what we've got to say on this subject. Obviously, massive thank you to Valeria and SSDP. You guys are smashing it. Massive thanks to Dasha, who is in the chat and done tons of work on this. Really appreciate all the effort you guys are putting into to reduce drug-related harm. Make my group on. Massive thanks to Arda. To be honest, Arda, you've done so much of the heavy lifting with this work. I feel really bad to just jump on a webinar and be like, oh yeah, data. Arda has worked like crazy to get all this information out there and analyze it and stuff. So yeah, awesome. Thanks so much. And if people are interested in any training or services around harm reduction, give us a shout. I do all sorts of stuff. Well, we at NeuroSight do all sorts of stuff, from like lectures for students to training police officers, social workers, and a whole range of stuff. So if you're interested in anything that's come up, give us a shout. We'll work something out, and I'll let the other panelists say thank you, and then everyone can be on the way.
Yeah, I mean, thank you everyone for coming, taking the time to watch this. And if a question pops up to your mind later that, while you're trying to sleep, just send us an email and yeah, we'll answer it for you.
Don't text me. I just put my text in one of the question answers things. So like, don't text me questions in the middle of the night. Just text Adam. Sorry, Larry, go on.
Oh no, I was just going to say thank you to you both for having me, and I put my personal email in the chat, and Dash has posted loads and loads of links in the chat, which I recommend you go follow.
Cool.
Fab. Thanks, guys. We always hang around for like an extra minute at the end, just in case anybody has another question or anything, or comment or anything. So feel free to ask. And also, it's really fun just watching Arda sort of struggle and finding it awkward at the camera, just watching her.